Good day, my name is Rainjan-Cyrey from Section 13E, Group 43, and I am from Davao Doctors College. So for today's assessment, I will be performing the patient care with bronchogenic carcinoma, or what we know also as a lung cancer. So this is a most common cause of a lung cancer is inhaled carcinogens. Before we start our assessment, I will be performing the hand washing procedure. So our rationale for that is to prevent the spread of microorganism and cross-contamination. The student is expected to introduce herself, perform a quick assessment of the patient's status including IVF checking and vital signs, and establish rapport with the client. Good day, sir. My name is Rainjan-Cyrey from Davao Doctors College, and I will be your student nurse from 7 a.m. to 3 p.m. So before tayo mag-start, sir, pwede ba na ako mapangutan na akong pangalan? Dexter Binay. So pila pang edad?
66 years old.
66 years old. Kala sa atong birthday?
October 11, 1956.
Okay. Sir, pwede ba na ako ma-check ang ato ang wristband? So, check lang nato yung wristband para ma-confirm na to if ito ba ang correct patient na ma-endure na to o correct care. So, bago ta mag-start, i-explain na ako sa imong daan na natay assessment na buhaton, and I assure you na tanan na information na mag-gather or data na ko na mag-gather from you is safe with us kay ang atong mga doctors o atong mga nurses na nga makahibaluan ni. So, aside ana makahibalo pud imong parente na nakalibot sa imo or magbantay sa imong pwede man sila mangutana sa atong nurses station regarding sa imong situation. So, bago ta mag-ingon na pud ko na mag-check ta sa atong BSO niya o kung naamang kay mga pangutana ayo lang kaula ug man sa amo kay ready man yung magtubag sa imong mga pangutana. Okay ba, sir? And one more thing, sir. Wala ba ta naigangan sa to ang lugar? Pwede na to i-adjust sa to ang aircon. Okay po. Comfortable man ta sa to ang place, sir. Wala man tay bad po. So salamat kayo sa atong information. Mag-check lang ko ang BS nimo. As a third-year nursing student, how would I mentally, physically, and spiritually prepare myself as a caregiver? Why? Why is there a connection of this preparation to my nursing care to Mr. Dexter Binay? As I interact with a cancer patient, I will not show sympathy, but instead provide the attention that the patients complain about in order to lessen the patient's stress, especially during this time of his condition. And I will encourage my patient in a way that I believe my care or intervention will serve as a basis to the patient that I am doing everything in my power and knowledge to help the patient in everything that he complains about or is uncomfortable with. I will provide interventions such as what is the proper nutritional intake in a high caloric diet. And I will provide vitamins because a cancer patient needs them to boost his immune system. And then I will remind the patient's family members not to give raw foods such as vegetables that are not properly cooked and fruits that may contain bacteria or microorganisms that can harm or can harm our patient. How would you say to yourself that as you enter the room of the patient, you are applying the nursing principles of the theory of Nightingale? Florence Nightingale environmental theory is based on 5 principles she felt were necessary to achieve a healthy environment. That includes clean water and clean air, basic sanitation, cleanliness, and light. Since the patient is in a reverse isolation, as I enter the patient's room, I will tell myself that I have applied the nursing principles of Nightingale. I am aware and well equipped with knowledge to perform my best to be an outstanding nurse in order to assure no harm to the patient, provide comfort and overall care to my patient, following the standard basic hygiene measures to protect the patients from harmful pathogens or microorganisms. Sir, muna ko click sa imong BS. So, dagwa ko sa imong temp, sa imong BP, sa imong RR. So, So kanang RR is nagfocus sa imong respiratory rate, which is ginakount nato kung pila imong kalinga in 1 full minute or sa isa ka minuto. Tapos nagfocus sa imong pulse rate, which is ikaw nato siya in 1 full minute pod. And also sir, nabatay yung mga laing pangutana.
Nurse, nga naman ko diri sa reverse isolation. Importante ba nasa kong sitwasyon? Ngano? Atagid ako og specific example, ana.
Okay, sir. So, ang reverse isolation is really to explain. A reverse isolation or protective isolation is done when a person's immune system is not functioning well or correctly. It is performed to protect you or a patient from pathogens, germs that can be spread through airborne droplets, medical equipment, or other person's bodies or clothes. So, a healthcare expert will consult you or with a patient about the measurements that should be taken based on the health of a patient or a person. So, for example for this is in reverse isolation, the child has cancer and the child may be in a room with a special air filtration system. So visitors, including both family and medical staff, must follow a strict hand washing regimen. So and also visitors must also wear masks, gloves, and hospital gowns, and no food except for the childhood cancer's food. So it is not allowed inside the room. So this practice is, or this method is to practice for protecting vulnerable persons for contracting an infection. What is the specific details on the ordered carboplatin? What is the connection of this pharmacological treatment with the pathophysiology of doctor's condition? What are the 5 nursing actions then for this? Carboplatin is used alone or in combination with other medication to treat cancer that has spread to other parts of the body, not to improve, or that has worsened after treatment with other medications or radiation therapy. Carboplatin is in a class of medication known as platinum-containing compounds. It works by stopping or slowing the growth of cancer cells. So why it is connected to Dexter's condition? It is because targeted therapy is a type of cancer treatment that uses drugs or other substances to precisely identify and attack certain types of cancer cells. A targeted therapy can be used by itself or combination with other treatments, such as traditional or standard chemotherapy, surgery, or radiation therapy. Sir, maghatag ko sa imuhang tambal karon. So, kani siya na tambal is ginatawag na to na carboplatin.
Gusto na siya tanggal para sa asa ka.
Ang condition na tambal is para din siya sa cancer cell, which is gina-prevent niya ang cancer cell na mukalat sa atong body. So sir, pwede ba na ako ma-confirm atong pangalan?
Dexter B9.
Okay. 66 years old sir no? So condition na tambal is gina-inject lang na siya. Okay? Thank you. What are the 5 nursing intervention or 5 nursing actions? So first is monitor closely during 15 minutes of infusion, since allergic reaction may have occurred within minutes of carboplatin administration. Next is regarding with the lab test, baseline and periodic CBC with differential platelet count, HGV and HCP. Monitor the periodically kidney function with creatinine clearance, tests and serum electrolytes. Number 3, monitor the results of peripheral blood counts. Median neither occurs at day 21, so it may occur leukemia, neutropenia, and thrombocytopenia are dose related and may be produced dose limiting the toxicity. Number 4 is to monitor the peripheral neuropathy, so autotoxicity and visual disturbance. And lastly is you need to monitor the serum electrolyte studies because carboplatin has been associated with decreases in sodium, potassium, calcium, and magnesium. Special precaution may be warranted for patients ordering fluoride therapy. So it is really important to check our patient after we administer this kind of medication. You need to say goodbye to your patient and to the watcher and family member. How would you do this? So, sir, human ako sa ako ang shift sa imo ha, o mag-end na akong shift. So ipasa na ta ka sa kong student nurse, and ayaw ka worry kay you are in a good hands man. So sir, thank you kayo sa atong participation during sa atong assessment. So nalang ko mga ipangbilid sa inyo before ko mag-end sa akong shift review. So pag naatay mga maramdaman ng mga signs and symptoms, dili lang ta maulaw na ingon sa atong nurse or sa atong doctor para ma-renderan dayon nato og immediate care. Okay sir? Tapos, kung natin ma-feel ng mga redness, warm, or swelling, or kanang drainage, pakiingon lang sa atong nurse para ma-applyan din nato again immediate care. Okay? So, nasabtan man nato ang atong medication kaganina sir, no? Katong ato ang tambal is para to siya sa ato ang cancer cell para ma-prevent nato ang spread sa cancer cell. Okay? So, mag-practice ang puta og proper breathing exercises kay since nagalisod pa man ka og paghinga, mag-practice ta og deep breathing exercise, inhale, exhale, and also pwede po tayo mag-practice sa tong first deep breathing na practice na nato pang ganina sir na. So, and also it's important na ma-render na ang relaxation sa atong environment, kanang malipay ka sa atong environment para process pa lang nato ang ataong lawas kay nagasabay man na sila. Kung happy ka, happy po lang nato ang cell which is naga-help sa imuha na ma-healthy ka. Okay? So mag-take lang po ta og mga vitamins, in kanang fluid intake, tubig para mag-ihi-ihi ta para magawas ato ang mga toxins sa atong body, and also padayon lang ta sa pag-take sa medication sir, dili ta maglimot-limot, tapos count og mga healthy foods para mag-improve ang atong immune system. Mao lang, thank you kay sa cooperation, and I hope na maayo na jud ka. Thank you po, bye-bye.
The student must simulate how to end the nurse-patient interaction, the end of shift. The student nurse must also endorse the patient to the staff nurse or incoming nurse.
Good morning! Endorsement. Endorsing patient Dexter B. 66 years old, male at room 315. Naka-reverse isolation si patient, admitted under the service of Dr. Sabido. So, admitted si patient tung last October 15, 2022 with chief complaint of shortness of breath. On VSQ for si patient, INOQ shift, latest vital sign BP 146/86, heart rate 115, respiratory rate 38, temperature 37, autosat 91 baba. So CBG done na po si patient with the result of 155 mg on high caloric diet si patient. Avoid lang taog raw food, tapos naka-bed rest with bathroom privileges po siya. So started na ang iyahang IV with normal saline solution of at 100 cc per hour at right metacarpal vein. So ang iyahang labs, ang laboratory ni patient, CBC done, WBCK low or BC low, HBC low, HCT low, platelet kay low. So with CT scan result na din si patient, ang findings kay pleural effusion sa iyang right lung, pericardial effusion and minor ascites. So thoracentesis and abdominocyantesis done with extraction of 1000 ml, clear yellow acetic fluid. So gihatagan po nako og kanang tambal si patient kagaina, gihatagan ako siya og carboplatin. So i-check lang nato ang site sa iyang tambal permi. So for close monitoring po si sir sa iyang vital signs or presence of hypotension, tapos tachycardia o possible hypovolemic shock. So maon lang monitor lang nato kanunay si patient. End of endorsement. Thank you.